And welcome, everyone. Welcome once again to In Touch. Once again, Dr. John Nowicki is back with us. And Nowicki Chiropractic and Wellness.
Thanks for having me.
We're going to talk about the human race.
Yes, the race we're all in, right?
The race and who's going to win, right?
You got it. The speed of life is what we travel at, and we're getting there fast, right? Unfortunately, with our first snow and hopefully, because I'm a winter snow loving guy, we get a lot more of those snowfalls this winter. The problem is that it's like Groundhog's Day every time it snows for people. We forget that it's slippery under those wheels, and even if we have four-wheel drive, you can start off quicker in four-wheel drive, but you don't stop any quicker because you got four-wheel drive. And you spin just as easy when you're in four-wheel drive, and you slide off the road just as easy when you're in four-wheel drive. So don't let that give you too much confidence out there, overconfidence, let's say. The older I get, the more I drive like the people that used to bug me. I drive like a grandpa. I set my cruise at 56, 57, and I think to the folks behind me, man, you got a passing gear. Yeah, I'm a gambler. I'm too over. I'm speeding technically.
Well, plus you're using that at the winter months.
Yeah, well, right. Not in slippery conditions. I'm not setting at that speed. Okay. But nonetheless, I because I've been in so many accidents, I don't want to get another one. I don't want to get another car crash in my life. The last one was at Brighting and 141 as I was heading north. The guy pulled out and tagged me, T-boned me. I don't want that to happen again. But if it does, and it happens to you out there listening, all right, we've got to document it right, because I've been out 29 years right now, 30 years. Okay. The problem with auto crashes is there's a lot of undocumented injuries that come with them, and they're undocumented to the ligaments. And people get fooled by car crashes and any kind of severe trauma, believe it or not. You get in a trauma, and you may feel bad the next day or two, but then you're going to go through a honeymoon period. And the car insurance companies know this. Okay, you'll feel better. Okay, about the 1 month mark. Hey, I'm feeling better. I guess I don't really need to go in and get anything looked at, or if you did get something looked at, I don't need to follow through with care. And that's when, ring-a-ling, you get this phone call from the insurance company adjuster who wants to be your friend, and they tell you, hey, how's it going? They pat you on the back, all this kind of stuff over the phone. And they ask you this wonderful question, knowing that you're probably better at this time. How you doing? And you say, I'm doing pretty good, because you don't want to be a wimp, right? And they say, well, why don't we just settle it and get it done with? And boom, they know a month from now, the odds are your pain's going to increase because that honeymoon period's over. But bam, you've stepped into their trap, okay, their mouse trap. So you got to be careful. You got to have it documented right. And that's what my office is set up for right now. Not only do we do a thorough case history exam to find out where your damage is as far as physical exam. I'll physically press on your spinal joints, the ones that are inflamed or the ones that have damage. Okay, but we'll do something called a dynamic surface EMG. Okay. This is looked at as the lie detector test, okay, for insurance companies. It blows their cover when they say, no, the patient's lying, they can't be in pain, they're still hurting, that's a bunch of Milorganite. No. When you do a surface EMG, as you bend forward, your muscles are supposed to relax, and you're supposed to just hang on your ligaments in your low back. But if you've damaged your ligaments in a car accident, those muscles can't relax. So you won't have this relaxation phenomena, and it'll show up on the EMG. And it lets us know that, you're for real, you're legit. Okay, so then we can let the auto accident company know that you really do have an injury. And that's part of our diagnostic workup. The other thing we do is we send out for what's called computerized radiographic mensuration analysis. What that tells us is, are your bones moving the way they're supposed to? Or are they moving too much? If they're moving too much, that's an indication of ligamentous damage. And again, ligaments are just the straps that hold your bones together. Most of us are aware of an ACL, anterior cruciate ligament in the knee. Man, Jordy Nelson tore his last preseason. He's just now starting to look like he did originally. And I'll bet that if you ask Jordy one-on-one in a quiet space, how's that knee doing? Is it back to like where you were before you blew it? He'll tell you, no, it's not. So even with the best care in the world that they can afford, NFL players, he's not going to tell you he's at pre-injury status. Okay? Mm-hmm. So if you don't give yourself the best care, and I think we give it at our office, okay, you're going to set yourself up for chronic problems.
Sure.
And here's the problem. The stats are this. With car crashes, 50% of you out there that get in a car crash will remember that car crash for the rest of your life. Every time you wake up, every time you try to lift your grandkids, every time you try to go out hunting, okay, fishing, driving on vacation, you're going to be sore and hurting. Okay? Mm-hmm. My goal is that as you come through care in my office, we not only do a thorough case history exam, objectify the injury, in other words, find out where it's at and have tests that show it, okay, so you can get the care you need, so that you end up reaching a point where you're on that right side of the 50%. You're not hurting for the rest of your life. Okay? Now, if you've been in a car accident already and you're hurting, give us a call. There still might be benefits out there for you. Michigan's got some pretty interesting insurance that may help you. Okay, insurance focuses on a couple things, okay, as to whether they're going to cover. Are you getting care right away after an accident? Mm-hmm. Or did you wait and wait and wait and wait? If you've waited, that makes it a more difficult hill to climb to convince them that your car accident caused your problems. If it did, you would have been in earlier. So if you get in a car accident, get in and get it documented right away. Mm-hmm. Whether it's to me or somebody, get in. Go to the emergency room, emergency department, get to your MD, whoever. Make sure you document what problems you're having. And if it takes a few days for them to show up, that's cool. Soft tissue, when you injure it, can take days to show up as far as aches and pains. Insurance companies know this. Okay? It's cool. Go get it documented. We have the technology to do it in our office objectively. In other words, using computerized testing to tell us exactly where the injuries are. But if you don't come to us, go to somebody, okay, and get that documented to protect yourself in case it does end up giving you problems.
Sure.
Okay, you've got to be able to show that you were damaged.
And odds are it's going to.
Yeah, the thing is that, and this was a study out of Yale.
Okay.
What they found was that anything over 8.2 miles per hour, as far as a crash and a stop, can cause injury to the occupant, even if it doesn't cause a lot of injury to the vehicle.
Okay. Sure.
It's almost like if, you look at, people say, well, how can you damage the person inside if the vehicle doesn't have much damage? Well, let's look at Jordy Nelson and football players.
Yeah.
Okay. They can take tremendous hits to their helmet. Okay. And yet the helmet doesn't show but a scratch. If that.
Yeah.
Maybe a marred finish on the new paint that they put on every week.
Sure.
But inside you can have a devastating concussion, a soft tissue injury. Okay, and we've seen that, right? What was his name? Kuechly, or I forget how you pronounce his name, the linebacker for the Panthers.
Okay.
I mean, here you have one of the best linebackers in the league, arguably, and they're carting him off the field crying because of a concussion. Crying. The same forces that he went through to get that, and they didn't look all that amazing and terrible on the replay, you're going to get in a car crash very easily.
Yeah.
Okay?
Sure.
So don't downplay the car crash by calling it an accident. It's not an accident. It's a collision. It's a car crash. And if you get on YouTube and Google crash test dummy testing and so forth, you can find all kinds of slow motion and slow accidents that people volunteer for. I would never, but people volunteer for it. They'll sit in a cart and have two people push them into a wall, and at like walking speed at 3 miles an hour, and they got the camera watching them on impact, and it's a jolt. Bam! I mean, it's kind of like if you were walking along, and let's just use 3 miles an hour. Yale said 8.2, but if you close your eyes, blindfold yourself, and start walking along at an average walking pace, which is 3 miles an hour, and you walk into a wall, how are you going to feel? Not like you're going to want to volunteer for it again, right?
No.
Yeah. I mean, it's a jolt. It's a bang. You might even break your nose at a walking pace if you hit just right.
Sure.
Okay? So if 3 miles an hour is enough, Go back to your last accident and ask yourself, how fast were you going? I was doing 57 miles an hour when I was T-boned. All right? Let's say you were doing 35. Imagine 35 miles an hour and running into a tree. Okay? Man, you wouldn't feel good, right, on a bike? But somehow we think, when we're in a car, we think, well, I can't get injured. No way. The reason we feel that way, I think, is that it's quiet. You don't have the wind rushing by your head. You don't feel how fast you're really going. All right? So think about your last accident. Think how fast you were going. And think about what we just said. Close your eyes and imagine running into something at 1/10 of that speed. Nobody's going to volunteer for that. I know I wouldn't. So, we use in our clinic documentation for AMA guidelines to document those injuries to the ligaments and muscles, and the Academy of American Pain Medicine, that's used as well. Those both, with the AMA, they want you to use clinically significant range of motion testing using what's called dual inclinometers. Ours is attached to a computer. It tells us what normal is, what your range was, but that's the gold standard, and the AMA wants that documented to the degree, to show the injuries. The Academy of Pain Medicine wants to know whether you're malingering. Are you faking this? And by the way, your insurance companies all feel that you're faking it. All right? They all feel that you're faking your injuries. So the surface EMG, when we do that, that'll tell us whether those muscles are bracing. You can't fake muscle bracing. So when you have that test done, the insurance company then understands that this is legit. So you've got to objectify it. And what's cool is people that have been in car accidents, we can help them with or without insurance. Okay? There's potential benefits for them out there that my staff knows how to find to help you get the benefits you may be entitled to. Not everybody is, okay, but you may be. If you're still hurting and you've had an accident recently, give us a call, 779-1300. Okay, people look at...
That is your lucky number.
That is. If you've been in a car crash, that's your lucky number to give a ring to. People look at these as, and they say, well, whiplash, that's just a sprained strain. Just a sprained strain? Well, so was Jordy Nelson's injury to his ACL. More than one pro athlete has lost their career over a sprained ligament.
It's true.
You're damaging the tissue that holds your bones together. When they become damaged, you have what's called ligamentous instability. Ligament instability is why you have pain one day and not the next. Why you don't have pain, and then you bend forward to reach up your grandchild, reach and pick him up, and boom, you're stuck there. Somebody's got a knife in your back. Like they got a cattle prod in you. Right? That's ligamentous instability. People say, well, I was told no one knows why I get it and why I don't. I'll tell you why you're getting it. You got ligamentous instability, and I'll tell you why you haven't been taught that or told that before. You didn't go through the testing that we have at our office, the dynamic surface EMG, the CRMA testing to show ligament damage, hypermobility. That's critical. So again, 779-1300, you need to give us a call if you're suffering or you've had a recent car crash. You need to have it documented right.
Like the TMJ?
Well, yeah, there's three things that all tie together. When you get in a car crash, you can damage ligaments in your neck. You can also bang your head against the inside of your skull and create what's called a concussion.
Yeah.
Okay? And right between the skull and the spine, so to speak, is that TMJ joint. It attaches to the skull, the muscles attached to the spine. They're intimately related. And I've got, in the next 2 weeks, 3 appointments to go and talk to dentists in the area about co-managing TMJ problems that can come from car crashes, but other things as well. And we're going to delve into that more next month.
Okay. Sounds good, Doc. Thank you.
Thanks for having me.
Dr. John Nowicki with us on In Touch. Any questions, call 779-1300. There it is. Your lucky number.
You got it.
Save your life.
These do. Addiction to pain meds, people commit suicide over it. They die from the side effects of it. We got to save you from that future potential.
Dr. John Nowicki, Nowicki Chiropractic and Wellness on In Touch. For In Touch, I'm Aaron Harper.